leukemias basically it's a term for blood cancer, and they are actually of majorly two types: acute leukemias and chronic leukemias. And then they are further classified from which cells they are originating. We have the white blood cells, which actually give rise to leukemias. Now, the white blood cells are majorly of two types: either the myeloid cells or the lymphoid cells. Especially the chronic leukemias and the acute myeloid leukemia is a common leukemia in elderly. Chronic leukemias, more commonly the chronic lymphoid leukemia, CLL, and the CML, they are usually found 50 years up and above age profile. The chronic lymphoid is actually rather more in people above 60 or 70 years of age. CML relatively in a decade earlier, starts from 55 above. Whereas when we talk about acute myeloid leukemia, it's again a disease of elderly. It happens in children as well, but in elderly as well, above the age of mid-60s. Likewise, acute lymphoid leukemia, lymphoblastic leukemia is also found in elderly, but is more common in children. There is no particular screening test over here, but yes, when they present, we actually get to know when either the hemoglobin is falling, which is also called anemia. The person might have shortness of breath. The person might feel fatigability. There would be tiredness. The patient could, in extreme case, go into congestive heart failure also. Chronic leukemias would just cause fatigue. When we talk about the other spectrum, that is the platelet thrombocytopenia, they would manifest in various sort of bleeds. It could be skin bleeds. It could be petechiae, small. There could be oral bleeds while brushing. There could be oral bleed. There could be blood in stools. Any site of bleeding is a concern and should be brought in notice of the doctor. I would say that the treatment for the past 2 decades have really gone better. There are now oral pills available for chronic leukemias, and these leukemias are now nicely controlled with these oral pills. If the patient is actually having a good organ function, good organ reserve, these patients are offered chemotherapy, intensive chemotherapy after discussion with their oncologist. And thereafter, if they are fit enough and they have a MASH donor, they should undergo a bone marrow transplant if in case the general fitness permits and the donor is there. There is a lot of discussion which is required. Patient empowerment with the knowledge should be imparted nicely, and the patient should ask questions to their oncologist and know what are the possible pros and cons about each treatment.